The most dangerous thing about a mini stroke is that it stops, the symptom clears, your arm works again, the words come back, and the brain that just sent the loudest warning is capable of receiving no response, because by the time you thought to mention it, you already felt fine. For most people, the logic is straightforward. If the symptom passed, the event was minor. If you can speak normally now, the speech disruption of 3 minutes ago was probably nothing. If both arms are working fine, the brief weakness was tiredness or poor circulation. That logic feels sound, and it runs directly backwards. A transient ischemic attack does not become less significant because it is resolved. It becomes more significant. The biological conditions that caused it are still present. The pathway that was briefly interrupted is still vulnerable, and a window has now opened that medicine can act inside, but only if someone reaches it in time. We are going through all 7 signs, and I want you to stay for sign 4. It carries no dramatic physical presentation. It looks like something people manage with a painkiller and forget about by the following morning. It is one of the most documented warning signs your doctor would act on immediately if you described it correctly, and the most consistently underreported symptom in the entire TIA literature for exactly that reason. Subscribe before we go into the signs. There is a specific internal conversation that happens in the minutes after one of these episodes. Something felt wrong for 30 seconds, a minute, 2 minutes at most, and now it does not. And the mind begins its work. You were sitting awkwardly and cut off the circulation. You have not eaten properly today. You have been under pressure this week, and pressure does strange things. You are 68 years old and bodies produce odd sensations. By the time you have run through the list, the symptom is already a memory, and the moment for raising it has passed without a clear enough reason to justify the disruption. You file it alongside the other things you noticed and said nothing about. You make a cup of tea, and the 48-hour window that could have changed what happens next has already started its count. Here is the information that is almost never communicated before it is needed. The risk of a full stroke in the hours and days immediately following a TIA is higher than at almost any other identifiable point. Research published in the New England Journal of Medicine found that 10 to 15% of people who experience a TIA go on to have a full stroke within 3 months, with the majority of those events concentrated in the first 48 hours. The medical interventions that reduce that risk work best inside that window. Most people do not reach care within 48 hours because the system has no reliable mechanism for teaching patients what the symptom that just cleared actually was. The explanation that follows a TIA depends entirely on the patient reporting it, which requires the patient to understand what they experienced, which requires a conversation that almost never takes place before the event. This boundary before we continue. If any of these signs are happening to you right now, stop watching and call emergency services immediately. A TIA and a stroke cannot be distinguished by symptoms alone, and both require urgent evaluation. If something happened in the last 24 to 48 hours that resembles what is described here, do not finish this video first. Contact your doctor today or go to an emergency department because the window is time-sensitive in a way almost nothing else in medicine is. What follows is for recognition and future awareness, not for retrospective self-diagnosis at a distance from the event. Sign 1. Sudden weakness or numbness on one side. Only TIA-related weakness is almost always one-sided. Both arms weakening simultaneously points to a different mechanism. A single arm, leg, or one side of the face that briefly loses strength, feels heavy, or becomes numb, and then recovers within minutes, is a specific neurological pattern that the brain's blood supply interruption produces. Research published in the BMJ identifies unilateral limb weakness as one of the most consistent presenting features of TIA and one of the most commonly attributed to sleeping position, poor circulation, or tiredness in the hours before patients seek any care at all. Sign 2. Speech that comes out wrong for a minute. This is not forgetting a word mid-sentence. This is producing the wrong word with full conviction. speaking in a way that does not match the intended meaning or understanding speech clearly, but being briefly unable to produce it. It lasts seconds to a few minutes and then clears. Most people describe it afterward as their tongue not cooperating or say they were simply tired. Research published in the Stroke Journal identifies transient speech disturbance as one of the highest value diagnostic signals for TIA when reported within the correct clinical context, and one of the most frequently minimized by patients when self-reporting. Sign 3. Brief vision loss or blackout in one eye. This is called amaurosis fugax, and it is described consistently as a curtain or shade coming down across one eye for between a few seconds and several minutes before lifting completely. It affects one eye, not both simultaneously, which distinguishes it from other visual events. Most people attribute it to eye strain, dehydration, or standing up too quickly. Research published in the Journal of Stroke and Cerebrovascular Diseases documents amaurosis fugax as a direct indicator of reduced blood flow in the carotid artery, supplying both the eye and the brain, making it one of the most actionable TIA warning signs when reported promptly. Sign 4. A sudden severe headache that passes within an hour. This is the sign with the least physical drama and the most clinical significance on this list. A headache that arrives with unusual intensity, unlike your typical headaches, reaches its worst point within seconds or minutes, rather than building gradually, and then resolves within an hour. Most people take a painkiller, rest briefly, and forget it entirely. It does not appear on the standard FAST acronym that most people have heard, which is precisely why it is the most underreported symptom in the entire TIA literature. Research published in The Lancet identifies sudden onset severe headache as a documented warning sign preceding hemorrhagic vascular events and notes it is the symptom most consistently absent from patient-reported histories, not because it did not occur, but because nothing about its presentation suggested it was connected to the brain's blood supply. Sign 5. Sudden loss of balance during normal movement. Not the gradual dizziness of standing up too quickly. A sudden loss of coordination during ordinary movement. Walking across a room and briefly needing to hold the wall. Reaching for something and missing it by a clear margin. The balance disturbance resolves within minutes, but the episode leaves a sense that something briefly overrode normal function. The BFAST assessment, which the American Stroke Association uses to expand beyond the original FAST criteria, adds balance and eyes specifically, because these symptoms are documented TIA presentations that the original criteria missed. Sudden, unexplained balance loss is listed as an independent indicator warranting urgent neurological assessment. Sign 6. Brief confusion or not knowing where you are. For 30 to 90 seconds, something does not process correctly. A familiar room feels briefly unrecognizable. A conversation partner's words arrive, but their meaning does not register immediately. Then it clears completely, and the person continues normally. In adults over 60, this is almost universally attributed to a senior moment, low blood sugar or fatigue, particularly by the person experiencing it. Research published in the BMJ identifies transient disorientation and confusion as TIA presentations that are among the most consistently misattributed symptoms in the older adult population, and notes that patients routinely reframe them in non-neurological terms before mentioning them to anyone. Sign 7. Sudden difficulty. Swallowing or facial strangeness. This is the least known sign on this list, and the one most people have no framework for connecting to cardiovascular warning signs. A brief sensation that one side of the face feels different, numb, or is not responding normally in the mirror. Or an unexpected difficulty swallowing during a meal, food going the wrong way in a way that feels neurological rather than mechanical. These signs involve the cranial nerve pathways affected by TIAs in the posterior circulation of the brain, a region that controls swallowing, facial sensation, and coordination. They are rarely reported because nothing about them suggests, to someone without clinical context, that the brain's blood supply was briefly interrupted. Protocol: emergency response and prevention. Two distinct parts. The first is what to do when a sign occurs. The second is what reduces the likelihood of it occurring. When a sign occurs, note the exact time the symptom started and the exact time it cleared. Note which side of the body was involved and what the symptom specifically felt like. Write it down on your phone immediately, because the exact language matters when you describe it to a doctor and the details fade faster than the symptom itself. Contact your doctor the same day, or go to an emergency department if your doctor cannot see you that day. Do not wait to see whether another episode follows. Bring the written note with the times. That specific information is what moves a TIA evaluation from vague concern to clinical urgency. The second part is the daily foundation, the evidence supports for reducing risk. Blood pressure is the single most modifiable risk factor for both TIA and stroke, and the most directly controllable through food. Reducing sodium and increasing potassium through vegetables, beans, and whole fruits supports lower blood pressure without any prescription required. Walk for 30 minutes on most days. Movement reduces both blood pressure and clotting risk through pathways that no single medication replicates entirely. Drink water consistently through the day, and not only when thirsty, because dehydration increases blood viscosity and clotting risk in ways that accumulate over hours. These three changes cost nothing and require no medical clearance to begin today. Tonight's 5 steps from this video. 1. Sit down tonight with one person in your household and tell them what a TIA looks like from the outside. Alan's outcome changed because his wife had a name for what she was watching. Give someone in your life that name tonight. 2. Write the phrase, "Time started and time stopped," in your phone as a standing reminder of what to record if a sign occurs. 30 seconds of preparation now is worth more than trying to recall details at an emergency department desk. 3. Check your sodium at your next meal. One practical starting point is replacing one canned, processed, or packaged food with a whole food equivalent. Start with the easiest swap. 4. Walk for 30 minutes tomorrow. Not as exercise. As the most evidence-supported stroke prevention intervention available without any form of prescription. 5. Send this video to one person over 60 in your life tonight. If they have already experienced a sign and dismissed it, this may be the difference between a TIA that becomes a warning and one that becomes something else. Before you close this, I want you to do something that takes 30 seconds. Think back over the last 12 months. Is there a moment that fits any of those 7 descriptions? Something that lasted a minute or two and then passed, that you filed under tired or getting older or one of those things? Write it in the comments. Not for me. Because writing it makes it specific enough to bring to a doctor rather than a vague concern you are carrying without words for it, and specifics save lives in ways that vague concerns do not.